So let me give you a little bit of background so we're all on the same page. Hepatitis B is caused by the hepatitis B virus, which is a blood-borne virus that can persist as a chronic infection. And with that chronic infection, slowly inflames the liver over time, leading to scarring or cirrhosis and the onset of liver cancer. Hepatitis B is the major cause of liver cancer around the world. Liver cancer is the third leading cause of cancer deaths worldwide. There's about 250 million people living with hepatitis B around the world. Countries in Asia and Africa have the highest prevalence or largest burdens of hepatitis B. In the United States, there are about 640,000 people living with hepatitis B. Most of those persons were born in those high prevalence countries in Asia and Africa. Next slide, please. Now, an important element of the mode of transmission and natural history of hepatitis B virus is that the greatest risk of becoming chronically infected with hepatitis B virus and then having that severe liver disease and liver cancer in the future is for young children, particularly newborns. Once infected, 90% remain infected. For infants, it's a little bit lower, about 50%, and only 5% for people who are adolescent and adults, that infection. So the critical vulnerable population to reach are newborns to interrupt that transmission from mother to child. Because once infected, 1 in 4 will die prematurely from liver failure and liver cancer in later life. And that's the health outcome we're seeking to prevent. Next slide, please. Fortunately, we have a hepatitis B vaccine. It's the world's first vaccine to prevent cancer, liver cancer. Since 1992, it's been recommended as a routine infant immunization here in the United States as well as worldwide. In 2005, CDC recommended that this vaccine be delivered in a timely way for all newborns in the United States. Multiple studies have shown the vaccine to be highly effective in preventing mother-to-child transmission, about 75%. Traditionally, it's been if the mother is known to be infected, the infant is also recommended to receive hepatitis B immune globulin immediately after birth so that you can increase that prevention effectiveness even more. More recently, women with high viral loads have been recommended to receive antiviral prophylaxis with tenofovir to lower that viral load and increase that prevention as well. The vaccine provides long-lasting protection, at least 40 years of protection after birth dose and infant immunization. Booster doses are not typically indicated, and the vaccines have excellent safety profiles. Next slide. Now, with the scale-up of infant immunization, which prevents transmission from one person to another through incidental blood exposures, an increasing percentage of transmissions now are from mother to child. That certainly is the case in the United States. And so that's why we're speaking of it today, to emphasize the importance of protecting newborns from hepatitis B virus infection. Next slide, please. So what you have here, you're seeking to bring together a combination of interventions. You want to have high coverage with hepatitis B vaccine. That includes a birth dose within 24 hours of life, followed by completion of the 3-dose vaccine series. You want to be screening all pregnant women to identify those who have hepatitis B to assure that their infants are receiving hepatitis B vaccine and hepatitis B immune globulin, and if the mother has evidence of high viral load, antiviral prophylaxis. Next slide, please. So this is the basic constellation of interventions that I just mentioned. Screening to identify pregnant women with hepatitis B, antiviral therapy for those with high viral loads, hepatitis B immune globulin, and then that infrastructure that of all infants receiving timely hepatitis B birth dose vaccination, followed by completion of the infant 3-dose series. Next slide. Some may ask, why do we recommend all newborns receive hepatitis B birth dose while you're also screening pregnant women to identify those who are hepatitis B? Well, first of all, there are a large number of pregnant women who do not receive that testing, and so their infants. It's not known that the infant's being born to a mother with hepatitis B. Not all of those exposed infants or pregnant women with hepatitis B are identified in a timely way for the perinatal hepatitis prevention programs that you'll be hearing about in a moment, are able to manage their preventive care. So the birth dose is really a safety net to make sure that the newborn is receiving that preventive service to maximize their protection, rather than relying on some other bit of information before delivering this safe and highly effective vaccine, which prevents mother-to-child transmission, as well as protecting the infant in the first months of life before that second dose of hepatitis B vaccine is available and delivered to them as part of the infant immunization series. Next slide, please. Our birth dose coverage has slowly increased over time. It's about 76%. The WHO target is 90%, which a number of countries around the world have achieved. So we still have some work to do to improve our hepatitis B birth dose coverage.